Good
Good morning,
morning,
Dr.
ma'am.
Sanjivani and Dr. Fareen too. I'm very much glad to welcome one of the most eminent personality what we know for, Dr. Sanjivani. And this is a platform uh, by IIPWC Women's Cell, Pune district. This is the recording which we are doing for the best of the excellent knowledge what our experts have to be shared with everybody. Today's eminent personality, Dr. Sanjeevani Kamble. She is having 14 years of her academic practice. Along with that, she's even done the PhD too. She is the district coordinator of Indian Association of Physiotherapy Women's Cell, Pimpri Chinchwad branch. She is founder of Ladies Fusion Fitness Club since 2019. Also shares as a member of World Federation of Neuro Rehabilitation, member of the World Stroke Organization, and also an active member of Indian Federation of Neuro Rehabilitation. Well, I know the time will go on with her all achievements. Over to you, Dr. Sanjeevani, for your topic ICF as a standardized tool for documentation in physiotherapy. Thank you so much.
Thank you, ma'am. Thank you very much for wonderful introduction uh, and giving this opportunity to share my this knowledge with all the viewers. So I request Farin, please share the screen. Yeah, thank you. Is it visible? Okay. So today's topic of discussion is ICF. And we all know ICF is a international classification of functional disability and health. But how this topic can we can use for documentation, because we all know in current system documentation one of the important part of our you can say daily routine. So how we can do better way of that documentation? So ICF is can be one of the tool which we can use for our standardized documentation, which will be accepted uniformly. Next. So always whenever thing which we buy or encounter or anything which we introduce newly, so first thing which we should know this 5-6 WH क्वेश्चन why who where what, जैसे छोटे बच्चे पूछते हैं कि ये क्यों क्या, तो हर एक चीज में we have to ask why this tool is we have to use, who can this tool we can use. So all these things we are going to cover in this session. Next slide please. So first thing, why? Okay. So as patient comes to us with one problem, okay, and he come with as a whole, he don't know the system. He doesn't come with मुझे न्यूरो का प्रॉब्लम है, मुझे मस्कुलर का प्रॉब्लम है. No, he not come with this. He come with मुझे पेन है. So for us, patient is as a whole. Okay. And again, as a physiotherapist, we always focus on range of motion, MMT, but फॉर पेशेंट दैट इज नॉट इम्पोर्टेंट. उसके 15 डिग्री से रेंज ऑफ मोशन बढ़े या 20 डिग्री से रेंज ऑफ मोशन बढ़े, उसको उसका कुछ लेना देना नहीं है. उसका उससे क्या होता है, मेरा हाथ कितना ऊपर जा रहा है, मैं ओवरहेड एक्टिविटी कर पा रहा हूँ नहीं कर पा रहा हूँ, मैं बैक पेन जो मेरा था उसकी वजह से वो मेरा बेंडिंग जो रिस्ट्रिक्टेड है वो हो रहा है या नहीं हो रहा है, ये उसका मेन प्रॉब्लम है. सो इट इज ICF will gives you patient as a whole system and it gives you the daily activity. Next, it is a scientific language and patient language. For example, in our day to day, we say as a range of motion is restricted due to infield or any restrictions or any immobilization. So this language is not matter for patient. Patient matters for because of what? In his language, because of pain or because of मेरे हाथ में थोड़ा सा अशक्तपणा है जे आपण मराठीत म्हणतो, it is like that. So that language in patient language is matter. So ICF gives you these things in patient point of view, I will say. So first is patient as a whole. It gives you daily activity and it will be all in patient language, not in our medical language. Okay. Next slide, please. So without ICF and with ICF. Go for next also. Yes. Yes. So without ICF means initially what we did. Okay, so as patient comes to us, we first do the system assessment. Okay, जैसे अपना evaluation form है, first we will do demographic data, then general examination and the system examination. Then उसमें functional assessment we will do, and according to that we will go for the traditional code. But with ICF, what it happens, patient as a whole, as I already mentioned, and it gives you the day-to-day activity. So it will be better for patient also, and we can easily we can say follow with patient in his language. या तुम्हें ये प्रॉब्लम था तो अभी ये तुम्हें प्रॉब्लम तुम्हारा सॉल्व हुआ या नहीं हुआ. In that way we can get the day to day activity also. Okay, next. So now what is the ICF? Okay, so ICF is a standardized language, and it is a framework which is described by health related states. Okay, and it's have four domain. For example, body function and structure, then activity limitation and participation. So these are the main domain of ICF, and it is majorly, I will say, it is a uniformly accepted and uniformly described by all the things. Means if any person is assessing the patient in India, so in same ICF we can communicate with out of India, means American or any other therapist and any doctor also. Not only the therapist, it is evolved around all, means doctors, nursing, any educators, they also use the same protocol. So that's why it is a uniformly accepted. Next. These are the main you can say component of ICF. First is the health condition, or you can say any patient, whatever the that health condition. It is divided into the body structure, function, then activity, then participation, and all goes to related to their personal factor and environmental factor. Next slide, please. So now what are the definitions? As we all know, definition are most important. Go for next, all four. Yes, that's it. Okay, so first is the impairment. So impairment is loss or abnormality of body structure or function, including mental functions. Okay, so means what are the impairment? When there is a loss of body structure, so that we call as an impairment. And activity limitation, when patient has a difficulty to perform their activity, that will be activity limitation. And because of that activity, the patient is not able to participate in his daily activity, daily things, that will be the participation restriction. And then facilitator and barriers, the we can say any motivators that will promote for their function, that will be the facilitator. And barrier, because of something that patient is not able to perform, take a treatment or activity, that will be the barrier. For example, knee pain, so in that there will be the joint structures because of osteoarthritis, that will be the impairment. Then activity limitation, patient is not able to perform full range of motion or extension, that will be the limitation. Then participation, because of that knee pain he is not able to walk, so that will be the participation restriction. And then according to that there will be the barrier and facilitators. Next. Now this is the one site which I will cover last, because of sharing issues. So this is the ICF book in which all your content, codes and all that is given. Okay, go for next. So now how we will see one by one. Okay, one thing, body structure, function, we will see one by one. So in body structure, what are there? There are 8 chapters in that book. Okay, first is the structure of nervous system, then these are the 8 chapters. So according to that we will code. Okay, and in every chapter there has some code. Next is body function. In body function there are 8 chapter again. This is, if you are seeing, this is related to function. For example, mental function, sensory function, so all are related to function. And previous was related to structure, means what are the happening in your joint, in your you can say brain, so that are the structure and these are the functions. Next. Now activity limitations and participation, these are coded by A and D. Okay, in that if you are able to see learning and general task, demand, communication, most are the activity which related to us, it is a movement, self-care, domestic life care and community social. Okay, these are the main which we mostly encounter or which we assess. Okay, next. Next are the environmental factor. So these are the environmental codes or chapters. From that we have to code the environmental thing, mainly which we see support and relationship and attitude, which we mostly assess. Okay, next. So now we will see one case and then we will assess. Okay. So for example, this is a case which mostly we encounter at the time of our exam. Means as we have neuro, ortho, musculo and cardio, in all there will be the 15 marks case. So how we will assess that ICF? Okay. So for example, 60-year-old man with have a CVA of hemiparesis since 1 month. Okay. And is visited to physiotherapy OPD. Then patient is able to sit independently but cannot stand and walk. Okay. And muscle tone of muscle is normal with MMT and grade 2 in upper limb and grade 3 in lower limb. So upper limb में 2 grade or lower limb में 3 grades. It is there. Then patient is a disoriented and has a pain in his shoulder and hand. This is a ICF, you can say, one stain which is given most of the time at time of our exam. Now how we can write it properly. Okay, go for next. So in this, if we are able to see, first we have to find out as our structure of ICF structure function. So we will underline in this term what is given under for structure and function. So for example, if we say structural impairment or diagnosis, so it is a CVA with right hemiparesis. It is a diagnosis. So that is your structural impairment. Okay. Then functional impairment, it is MMT. Okay. And disoriented. That can be your functional impairment. Then activity limitation and participation limitation. So activity limitation, patient is not able to sit, he can sit independently, that is integrity. Okay, he is able to do, but he cannot stand and walk, that is his impairment. Okay. And again in his shoulder, again this is a functional. So we have to underline the things what is come under your structural impairment, functional impairment, activity and participation. So according to that we can write our whole ICF. Okay, so go for next. So these are, as we initially saw, what are the structural impairment. Okay, so in this we are able to see first structural impairment in this 8th chapter. Now from this, which are the important? So first go for next. So what are the integrity that we have to see? So first integrity which we are able to see, structure of nervous system. So go next. It is not integrity. Next. Go for next. Again next. So these are the go previous, one slide previous. So this, sorry for this slide. So these are the integral part of that patient, because patient has a central nervous system, means neuro patient. So these are the integrity part. Okay, and go for the next. These are the structural impairment in patient, as patient is a CVA patient. Okay, so what are the lobe are involved, what are the cranial nerve, then cortex, and these are the involved area. If we have, very good. If we don't have, so you can say logically and according to our pathology physiology says, we can say according to CVA patient these are the impairment. And what are the source of information? Definitely frontal and parietal lobe. If we say it is affected, so it will give we will get the information from CT or MRI. So this will be the source of information for various impairment. Okay, next. Now comes to your body functions. Okay, so in that also we have to say the impairment and integrity. Go for next. So these are the next. Go for next. Next. So these are the functional integrity integrity which is available in patient. For example, voice and speech, then function and cardiorespiratory, then function of digestive and the genital reproductive system, which are the intact in patient. Okay, next. And why integrity is important? Because on the basis of integrity we are giving treatment to the patient. Yeah, ये patient में integrate part है, so that's why with the help of that we can use that part and then we can give the treatment. Next. Yeah. So now functional impairment. Okay. Functional impairment decrease the mental attention. आ रहा है सुनो? आवाज आ रहा है?
यस मैम। यस मैम।
ओके
मैम यही स्लाइड की स्टार्टिंग से प्लीज स्टार्ट कीजिए।
ओके
बीच
फाइन,
का मैं
थैंक
ये
यू।
जो अटक गया था वो एडिट कर दूंगी।
ठीक ठीक चलेगा।
यस मैम।
Okay. So, functional impairment. In this functional impairment, decrease the mental function and orientation, then loss of memory, then loss of sensation in left upper lip and lower limb. And this all are the source of information. Is some are the investigations, some are our assessment. So this will be this is also important source of information. Then difficulty to perform activity of left side. Okay. Then difficulty to maintain the balance. These are the main problem, because if patient has a weakness, so definitely there will be a problem in balance. So these are the functional impairment and source of information are this. Okay. Next. Yes. Again, there are some functional impairment that are transitions, difficult transition, because he's not able to sit to stand. Okay. So the walk, it is transition is a problem. Then unable to stand, unable to walk without a support. So these are some impairment that we have to mention as which is given from your STEM. Okay. And source of information, again, clinical investigations and your assessment. So next. So now, what are the activity limitation and participation restriction? So go for the next. No. Okay, fine. So these are the impairment. For example, in activity limitation, learning and applying knowledge. Okay. And source of information is MMS's case. So, and clinical reasoning is affection of higher mental function. So because of this, patient is able to activity limitation. Then general task and demands. So source of information, again, clinical examination and clinical reasoning is higher function affection. And impairment again in activity media communications, because of communication there will be the problem in speech. Okay. Next, as in communication, because of communication, what is the activity which is affecting in daily activity, that will be the problem. Okay. Then impairment, changing body positions, changing from lying down to the lying down, then maintaining lying down. So these are again some activity limitation that patient will have. Okay. Next, patient having a problem of walking short and long distance both, then walking on a different surface, then walking around the obstacles. So these are the some impairment patient having. Okay. And again, source of information is clinical investigation and clinical reasoning we have to give because of hip, knee and ankle weakness. For example, now this we are not assessed because this is the stem and which we are giving. For example, exam, if we are. So, but as we know, patient is not able to walk and this. So might be this can be the problem. So that we can write. Okay. And in clinicals, definitely we have some reasoning on that basis we can give reasoning. Okay. Go for next. So activity. So now mobility. Here capacity and performance, these are the two things which we have to keep in mind. So in case of mobility, patient can roll to either side with mild difficulty to move on affected side, that is his capacity. And what is his performance? Patient find it difficult to roll on bed due to the less space and has a fear of fall. Means, for example, take an example of your OPD. Okay, we are making patient to sit to stand. Okay, so we ask the patient to stand, so he will stand with difficulty, or maybe he will not stand with because of fear and all that. But in that case, if we have 3-4 therapists in front of him, we are holding him, we are guarding him, and then we can make him stand, so he will stand. So in that, his performance will be good. But capacity means he has capacity, and according to that his performance is doing good. So sometime it will be go vice and versa. ओके मीन्स वही उसको घर पे खड़ा करने के लिए बोलो, तो मे बी उनके पास कैपेसिटी होके भी वो उनका परफॉर्मेंस पुअर होगा because of environment barrier. So there and barrier and buffers will be matter, but here we have to work with capacity and performance. So capacity and performance will be matter according to your environment setup and your all support. Okay, next. This is again one of the example for capacity and performance. Next. Yes. So now barrier and buffers. Okay. So for first barrier, design, construction, building products and technology. For example, if same patient has to go by bus, okay, and he has a very difficulty while means after some days definitely, so he want to catch the bus. So he has a very difficulty to catch the bus because of that you can say infrastructure or that facility is not available in bus. Okay, ramping and taking of wheelchairs and all that. So that will be the barriers. Okay, and facilitator, he is trying to take a treatment, that family support is there for taking a care of him, that will be the facilitator. Then all health professions, all team will be your facilitator. Again, source of information will be the clinical investigation and case history. Next. So these are the basically codes: B for body function, S for structures, D for activity and participation, and E for environmental factors. So these are the basic, you can say, code for your ICF. Next. So again, we have some ICF core set. Now question arises, there are so many core set and codes. How we will remember it? So not necessary. We don't have to remember each and every you can say code. There are ready-made core set are available. From that we can go for this coding and we can get the ready-made your assessment. Okay. Next. So who can do? Undergraduate, postgraduate, teacher, researcher, educators who are available in your health system, all can perform your ICF. Okay. Next. So in UG curriculum, definitely it is included into your third year and final year, and it should be in clinical practice. Whenever you are assessing, so you should go with your ICF, then only you can make your documentation very properly. Next. So what for the patient, student, sorry. So whenever the ICF is come in mind, when I was also student, so that coding, it is very difficult and it is very lengthy. So how we can do? So it first thing, no baba, it is थोड़ा सा टेंशन आता है कि इतना बड़ा कैसे करना है. So it is panic condition, but don't get panic. If we know how to do it, so it is very easy to do it with the help of core set. And next thing, which is most important and beautiful thing from your ICF, it is give you short and long term goal. Okay, on the basis of that ICF core set, because when we mention the activity limitation, so it is nothing but your goal, because what जो patient नहीं कर पा रहा है वही अपने goal है. So definitely it will be your short term or long term goal. Okay, next. Then expectations from teachers for ICF, because this is the more common part which we have great, means you can say maximum weightage in your question paper. So always I mention ki if we are setting the questions paper for third year, so give the diagnosis, and if we are for fourth year, so we can mention the clinical features, and from that student can diagnose the case. So provide the diagnosis in third years, baki you can give other things, but concise list of your clinical features. Okay, and your example should be simple and it should be concise. Okay, क्योंकि ICF में बहुत सारा mention करना है, इसका मतलब ये नहीं we have to mention all the stuff. Okay, and describe the application and patient in a case. It should be like describe properly whatever the required. Okay, and it should be simulated case. whatever we are encountering in your day-to-day clinics, that also we can write, but it should be descriptive and simulated case. Next. So now PG curriculum. So what we have in PG curriculum, again, as such, they don't have the answers, questions answer in this, but in that they can assess in clinical setting this ICF. Okay. Next. And again, PG or researcher, you can use this as outcome measures for your assessment measure. So now piece of advice, what is there in ICF? So that never ever go for directly for ICF. First, we have to assess the patient and then we can go for your ICF examination. Okay. Go next. So for this entire ICF, I give acknowledgement for my two guides. First is Catherine, under whom I ICF as a trainer under WHO, and Dr. Suvarna Ganvir, who always mentor for my any all activities, and ICF also. So these are the main mentors for me. Thank you, ma'am. Next. So thank you very much. Any questions? So you can ask. Thank you.
Ma'am, as a student, we usually use ICF for documenting only the case impairments. But a lot of time the query comes that in the usage of capacity and performance, we get
Right.
confused as to what is capacity and what is performance and how to grade it when we are talking about mild, moderate, and severe. If you could please throw some light on that.
Actually, capacity and performance. For example, if we take the patient of neuro patient, okay, we want to make him sit to stand. Okay, so in OPD, if we ask patient to make a sit to stand with all therapists around, so he will stand properly. Okay, means whatever he has a phobia or fear, he will overcome that and he will stand. Okay, so that is his performance. Okay, but same situation if you take at home. Okay, and if you ask him to stand, so will he stand? No, because of environment barriers, say that performance will be the poor. So it will always depend on your environment structure, capacity, and performance. Means we can't always say ki, performance will be better and capacity will be the poor, or capacity will be the better and the performance will be the poor. It can't be said always. It will always depend on your environment structure. Means depend on your environment structure, capacity and performance will be vary according to conditions. Okay.
Thank you
Hope it
so
is
much,
clear.
ma'am. Yes, ma'am. Thank
Thank
you. Handing over to Varsha, ma'am, for the vote of thanks.
Thank you so much, Dr. Sanjivani. It was definitely an insightful lecture. Well, I think many doubts are being cleared, and we would like to implement the same things, keeping all the measures, whatever you have said. Hope we have many more ventures like this. Thank you so much. Thank you, even Farin, Dr. Farin, to coordinate. Thank you so much, Dr. Sanjeevani.
Thank you, Varsha ma'am. Thank you, Farin, and thank you for giving me this opportunity. And thanks IIPWC Pune district for conducting such a wonderful innovation and series of lecture through which all community will be grow, and definitely it will be the, you can say, achievement, and it will be the great advantage for all our faculty and student also. So
Sure.
thank you very much and all the best.
Learning is a process, so we are into this process. Thank you so
Thank you, ma'am.
much.
Thank you.
Thank you.